The ads are impossible to escape. They are diabetes drugs whose major side effect is weight loss. But what about the other side effects and the staggering out-of-pocket costs?
Now, this is Talking Points on CBS News Minnesota.
Good evening and welcome to Talking Points. Tonight we are taking another look at the surging popularity of the diabetes drugs Ozempic, Wegovy, Rybelsus, Mounjaro, and Zepbound. Only two of these drugs, Wegovy and most recently Mounjaro, have been FDA approved for weight loss. Not always covered by insurance, the out-of-pocket costs for these medications can top $1,400 a month. Desperate patients are now in two classes, one whose insurance will pay and one whose insurance won't pay. Tonight we'll visit two patients, one in each category, and we'll check in with two doctors, one who says you will need to take these medications for the rest of your life to keep the weight off. But first, a cardiologist who says the newly discovered benefits of preventing strokes and heart attacks could change the insurance equation. Joining us right now is Dr. Michael Miedema from Allina Health. Thank you so much. You're a cardiologist. We appreciate your time.
Thanks for having me.
All right, let me ask you, new study out, New England Journal of Medicine, says that one of these medications actually reduces the risk of heart attack and stroke by 20%. This just came out. How big a deal is this?
It's a really big deal. This is the first study we have showing that treating obesity as a risk factor can actually reduce cardiovascular risk. The whole point of treating a risk factor is to reduce your risk for heart attack and stroke, and this trial actually showed us that you can do that.
I know that you're the person that treats people. You don't deal directly with insurance, but are you hopeful that this might change the position of some of these insurance companies as we see these additional benefits to this drug?
It's a big deal because cost is obviously an issue and we want to be cost effective in our treatments. And so I understand hesitation of a payer to approve a medication when it's costly, when we don't have great evidence that it works. But now the evidence continues to build that when we use these medications, they're not about cosmetic weight loss. It's about making people healthier. And this trial very clearly supports that. When people took it, they had less heart attacks and less strokes.
Now, doctor, people will hear you're saying it's not for cosmetic reasons, but then we heard you also say that, going after weight loss reduces the risk clearly in these studies. What's the difference? Because I think most people will be like, well, that's the same thing, isn't it?
I think the difference is in the group that you target. So this trial only took people who had established cardiovascular disease. So they had already had a heart attack, they had already had a stroke. We're trying to help them avoid a second one. We know that that's a very high risk group. And so when weight comes down, blood pressure comes down, cholesterol gets better, blood sugars get better, just makes them healthier across the board.
Okay, so these people had established heart disease, but in general, they were overweight.
Yep, they had a BMI above 27.
Can you just tell us, how did these drugs work?
Yeah, it's a little bit complicated, but they basically block a hormone in the gut. And when you block that hormone, you slow down gastric emptying. So you slow down how your stomach processes food. So people need to eat less and less often in order to feel full. And that's what leads to the weight loss.
Okay. Is this a miracle drug? It just sounds like we're getting more and more positive results, or are there hesitations for that kind of label?
Yeah, I don't know if I'd say it's a miracle drug, but definitely for weight loss, we have not had significant beneficial medications in the past. They tend to come with pretty significant side effects. And so this one can have some GI side effects, as we know. And on rare occasions, it can be serious GI side effects. But in terms of risk versus benefit, this seems to have a lot of benefit in favor of using the medication in a lot of people.
Who are you prescribing this medication to?
It's mainly people who we want to reduce their cardiovascular risk and improve their cardiovascular health. So again, people with established cardiovascular disease that have had a prior stroke, that have had bypass surgery, that have had a heart attack. And then in some cases, we use it before they've had that, what we call primary prevention, where if somebody's really high risk, we know they have plaque in their arteries, they have a bad family history, they've got high blood pressure, we want to lower their risk factors as much as we can. It's a pretty effective tool to do that.
All right. Well, thank you so much, doctor. I really appreciate your analysis.
No problem. Anytime.
Joining us right now is Dr. Iesha Galloway-Gilliam. She is the medical director of the Comprehensive Weight Management Center at Hennepin Healthcare. Welcome. Thank you so much.
Thank you.
All right. We're taking a look again at these weight loss drugs. I assume that you have many patients who are either asking for them or who are on them. What are the side effects that you're seeing in your practice?
The most common side effects from this class of medications is GI distress. nausea, vomiting, diarrhea, constipation, abdominal discomfort. Those are the most common side effects from this class of medications. Typically,
Go ahead.
typically at the initiating doses, with time, people will acclimate to the medication. Not everyone does. Some people continue to have side effects despite the slow up titration that occurs when we're dosing the drugs, but those are the most common side effects.
Of the patients I've talked to, all of them said they had that initial side effect, and then when they were, as the drug was adjusted, they got used to it. A couple of people have told me, though, it was so severe that they just couldn't handle it. Are you seeing some people like that?
Yes, and there are a cohort, a subset of patients who will not tolerate the medications. It's as with anything. Everybody's body is a little bit different. There are going to be individualized factors that will affect how a person tolerates a medication. And for those patients who are absolutely unable to tolerate the medication, then we know it's not a good fit for them. And then that's a sign from the body that we need to discontinue it.
One thing I wanted to ask you, I mean, you are in charge of a medical weight management center. The issue for so many people is it's even harder to maintain the weight than it is to actually take it off. Do people have to be on these drugs for the rest of their lives to maintain this healthy weight?
Yes, it's the medications are only as effective as they are taken. Meaning once the medications are discontinued, the effects from the medications are discontinued as well. The medication doesn't permanently impact, adjust, or change anything about the way that our bodies work or function.
Okay, so you do basically have to take it or else.
That's correct. It's a long-term, lifetime commitment.
One of the things that the patients I've spoken to have talked about, and they've all said it, is that the food noise goes away. That nonstop, I've got to get something to eat even after 4 meals. Is that what you're hearing? I mean, I mean, is that a real thing?
Yes, it definitely. Anecdotally, I have had a significant number of patients who have expressed this experience from this class of medications, and that they feel less um, impacted by cravings or thoughts about sort of obsessive thoughts about food, better hunger management. And part of why that likely is that the receptors for these medications are scattered throughout the body, and one place where the receptors are is in the brain, an area of the brain called the hypothalamus, which is critical in weight management and hunger.
Okay, that's so interesting. Well, Dr. Galloway-Gilliam, thank you so much for your time. I really appreciate it.
Thank you.
Up next, we'll visit a Mounjaro patient whose out-of-pocket costs for the drug have increased from $25 to $500 a month and could even double. Well, joining us right now is Lori Rock, a Twin Cities resident who was kind enough to share her story on Mounjaro a few months ago, and now you're kind enough to share your story again. How are you doing, Lori? You've been on this drug now for quite a long time.
Yeah, doing good. That's 13 months since I started it, and I'm so grateful for it. It's worked really, really well for me.
Okay, and tell us, you're on Mounjaro, right?
Yes. Yep.
Okay. And we've got some before pictures, and we also have the picture from a few months ago. Obviously, you're down. Do you have a total for how much you're down?
I've lost 130 so far.
Wow, okay.
Yeah.
And how did you get on the drug? Had you just heard about it? Did you ask about it? Did your doctor suggest it? How did it all happen for you?
I had not heard about it. I was at a doctor appointment, and I asked her, what can I do, because I was about at the end of my rope, and so she suggested that I do this, and it's worked out fantastic for me. I'm so grateful.
So your physician brought it up because you were concerned. Were you having other problems, weight-related problems like hypertension?
Yeah. Yep. High blood pressure. I was just having trouble, walking in from here to there, really, because it had gotten so bad and out of control. And I had tried, many times for years, and nothing. I just couldn't get it done until
And
started.
what are some of the things you tried?
Exercising, cutting calories, just the normal diet stuff.
Now, your doctor suggests Mounjaro, but did your insurance cover it?
It didn't. Well, no, it did not. Eli Lilly did have a coupon though that allowed you to pay $25 a month for a month's supply. Unfortunately, that only lasted until June of this last year. So I was able to take advantage of the coupon for about 8 months.
Okay, 8 months. And how much was the coupon for?
It allowed me to pay $25 a month for a month's supply.
Well, that's reasonable. The coupon expired though
Yep.
this summer. How much have you been paying without the coupon?
So they issued another coupon, and my pharmacy was good enough to honor it. So I've been paying around $500 a month since June.
And that's with a coupon?
Right. Yeah.
Okay. Well, what would it be? And how long does this coupon go for?
I don't know. I think until the end of the year, but I mean, things could change. They could change it at any time. That's in the fine print on the coupon.
Because $500 is obviously a lot of money out of anybody's budget.
It's a ton.
How much would it be without any coupon?
It'd be twice that amount.
$1,000 a month.
Yeah. Yeah.
Okay, and you don't know if this coupon is going to continue.
Correct.
After the first of the year. We're almost there. I mean, how does that make you feel?
It's very stressful. It's very stressful because number one, I'm not at my goal yet, and number two, I might have to be on this for the rest of my life. So and for sure it will get better over time. I just don't know how much time it's going to take, because there will be other manufacturers coming out with the same kind of drug.
Have you tried? I mean, Wegovy has been approved for weight loss. Is it possible? Have you asked your doctor about that or prescribing that one, or can she do that?
I haven't talked to her about it yet, but the thing about Wegovy is it's basically the same price, and Mounjaro is a little bit more effective than Wegovy, according to the trials, and it's a different kind of drug. It's something in addition to Wegovy. So I want to stick with what's working for me.
Of course. Of course. And how about side effects? Because some of the side effects are pretty brutal. Bowel blockages and nausea, vomiting.
They were at first. I never had any of that extreme stuff. And over time, they've gotten I really don't have many side effects at all anymore. They kind of go away over time as your body gets used to taking the drug. So yeah, I mean, side effects are minimal right now. Do
you feel at all misled or somehow sort of you got hooked onto this with this coupon and that was, at $25 a month. Now you're paying $500. I mean, that's a lot for anybody.
Yeah. Yeah.
And now you may even lose it and it could go up to $1,000. I mean,
yeah,
that's got to worry you.
Yeah, definitely. It stresses me out a little bit, but yeah, it's very frustrating, to find something that works that has made such a huge difference in my life and in my health. And, the fact that I have to pay so much to get that is really frustrating. One thing that has happened in the last 3 weeks is the FDA has approved Mounjaro for weight loss only. So hopefully that'll make a difference in the cost, and hopefully my insurance will maybe start covering at least part of it. I don't know, time will tell.
Have you, insurance companies are, in my experience, very hard to talk to. Have you tried talking to them?
I did. I actually just talked to them yesterday. I got a number for what they call an advocate, but she wasn't a whole lot of help at this time. I think because it's the FDA approval is so new. I told her I would check back in a month or so.
And I don't want to contribute to your anxiety, but you have to have thought about this. If in fact your $500 a month coupon expires at the end of the year, which is just a few weeks away, would you continue and pay $1,000 a month, or do you think you might try going without?
You know, one thing that I talked to my doctor about, I talked to my doctor about that, and she suggested one thing we could do is maybe space out the medication a little bit more. You know, instead of paying $1,000 for 1 month, pay $1,000 for 2 months. Therefore, you know, we're back to the $500, which is still stressful, but and that scares me too because I don't know how well that's going to work. But it's one option.
What, people I think are so interested in this, and I'm sure people have come up to you and just talked about how great you look. Obviously, you feel great. What advice do you tell them, and what advice would you have to people watching this?
I mean, it's you still have to diet and exercise, and eat right. You know, it's not like you just take a pill and or take a shot and everything goes your way. You still have to work at it, but it's so worth it. So worth it. I mean, obesity is a disease like any other disease. It's not just a matter of self-control. And this drug has allowed, it's a tool that will help you get where you need to be. And it's so worth it because my health, um, it's night and day difference, night and day.
Well, Laura, thank you so much for sharing, and we wish you all the best. We wish that financially this works out for you, because I know you're not alone in this. I really appreciate it. You did a wonderful job explaining your story.
Thank you, Esme. I appreciate it.
Up next, another patient who is also in the 100-pound weight loss club, but her insurance covers 100% of the cost of Wegovy. Joining us right now is Laura Collins, who was nice enough to share her story a few months ago, 4 to 5 months ago with us, and we just wanted to revisit you right now. How are you doing?
I'm doing great. I couldn't be better. Thanks.
Okay, you look great. The drug that you used was Wegovy. Tell us about your Wegovy journey.
I think this drug was tailor-made for me. I mean, I started losing from the very first dose of the medication. I had minimal side effects, nothing that would ever stop me. And I'm maintaining a 100-pound weight loss. I was able to titrate down to a lower dose, which is helping me maintain. And the best thing about it is I'm not constantly obsessed about food 24/7. So I actually get to live my life.
Wow, okay. I want to ask you a couple of things there. So for 2 years you were on, for how long were you on the larger dose?
Well, you titrate up you go up a dose every
Okay.
4 weeks to what they call the maintenance dose or the effective dose, which is 2.4. I was on that, gosh, I'm sorry, I wasn't prepared for that. I was on that for a few months, and then I kept losing weight, so I had to titrate down to be able to maintain my weight.
Interesting. And your insurance has covered this all along. Do you just pay a deductible?
I pay a deductible, and at this point, I don't have any cost associated with the medication.
Wow. Okay. And tell us about the maintenance part of it, because I think this is something that people really care about. They have this remarkable success, and then can they maintain it? How have you gone about maintaining it? And at the meantime, you've also reduced the dosage that you're on.
I've always had a pretty clean style of eating. I just was obsessed, and I would overeat. I mean, you overeat even healthy foods, you're going to gain weight. But now that I'm not obsessed with food and it's in the background, it's not even an issue. So maintaining is good. What this has allowed me to do, because the weight is gone, I'm now doing yoga every day, and I'm walking more, and I'm just developing even more healthful habits, which of course, is good for everything all around.
Right. And in terms of the maintenance, is it a straight line, or do you sometimes get the cravings, if you can describe that, the food noise?
Every now and again, it'll come back. Like if I stretch out my medication to every other week, after a couple of times like that, sometimes I'll start getting all that chatter in my head. And that's when it's really important to fall back on all these great habits that we're building up in the meanwhile. So until I change my dosage back to weekly, I remember all of the new habits that I've developed to help me through those things. And then I get back to like an equilibrium.
So do you actually have to sometimes go up a little bit in your dose for maintenance?
I have not gone up in my dose. I have sometimes, instead of doing it every other week, I'll go back to every week, depending
I
on
see.
how I'm
I
feeling.
see. And that makes that much of a difference?
Yeah, it does.
It really does. But
For
you've
me,
been
it does. For me, it does. And like I said, this thing is so tailored. You ask 10 people, you might get 10 different answers.
right. Has that been difficult? I mean, that requires a lot of discipline. I mean, if I can just ask, do you see a counselor? I would imagine some people, because this is a lot of mental games here, you know, do you get help for that? Or are you just able to do it yourself?
Over my lifetime, I was in OA, I was seeing a food counselor. I did a lot of that many, many years ago. So I have a pretty good background in that. At this point, it was just dealing with that addiction type obsession. And from what I understand, the studies are really showing that it is amazing for that particular aspect of it.
Right, and there are new health benefits coming out as well. Is there anything you'd like to tell people? I mean, you're in the fortunate position of having it covered.
Yeah.
What would you advise people or tell people?
I would find a doctor who is really knowledgeable about this. Not all primaries are. If you have to go to a bariatric or to an endocrinologist, I absolutely would. Find someone who supports your journey in this. Surround yourself with positive people who support. And don't tell people if you feel you're going to get some blowback about it, because anyone who's been struggling with this their whole life knows how devastating and how difficult it is.
That's a good advice. Just don't tell people, but people must turn around and go, really? Is that you?
Some do. And people who are struggling, I will confide in them. People who are just curious, I'll say, no, my husband locked me in the basement for a year and that's how I lost it.
Okay. Well, thank you so much. I really appreciate your
You're
sharing your
welcome.
story with us and the update. You look
Well,
great.
thank you.
And that does it for this edition of Talking Points. As always, email me with comments and suggestions at esme@wcco.com. The show airs every Wednesday and Thursday night at 6:30 and 9:30 p.m. Thank you so much for watching. I'm Esme Murphy for WCCO News.